Heather couldn't breathe, heart racing, chest tight, mind spinning with thoughts she couldn't control. She felt like she was having a heart attack. She tried 8 different medications for anxiety and depression. She had periods of improvement here and there, but continued to struggle. Then we discussed a nasal spray with her. She had one dose, and within hours, something shifted that hadn't moved in years. Hi, I'm Dr. A. I'm an integrative psychiatrist and lifestyle physician. Let's talk about what happened when Heather tried esketamine for her crushing anxiety and depression. I'll explain why this medication isn't approved for anxiety, but why it might still help. And I'll reveal the one thing that made the difference between her feeling relief versus feeling nothing at all. Stick around because what I share at the end could change how you think about treating menopause anxiety. For 2 decades, 46-year-old Heather had managed her depression and anxiety reasonably well. Then perimenopause hit and everything fell apart. She felt like she was drowning, mind racing, not sleeping, snapping at everyone. She had recently been on sertraline, fluoxetine, venlafaxine, mirtazapine, and Seroquel XR. Some helped a little, most did nothing. Her anxiety remained relentless, crushing, exhausting. That's when we discussed esketamine, also known as Spravato. Now here's something critical you need to know. Esketamine is not FDA approved for anxiety. It's approved for treatment-resistant depression. But here's what happens clinically. Many women with depression also have severe anxiety. And when their depression improves, their anxiety often improves too. Research shows this connection clearly. Studies show that patients treated with esketamine for depression experience significant reductions in anxiety symptoms as well. So while Spravato isn't technically an anxiety medication, it's been clinically helpful for many women struggling with both depression and anxiety. If you're finding value in this video, subscribe to this channel so you don't miss out on future content. Let me explain what makes esketamine different from every other antidepressant Heather had tried. Traditional antidepressants work on serotonin. They slowly build up levels over the course of weeks and months. But esketamine works on glutamate, your brain's primary excitatory neurotransmitter. Think of your brain like the highway. Depression and anxiety create deep grooves in the asphalt. Your thoughts keep racing down the same one undulating road. This causes worry, panic, negative thinking, and mood swings. Esketamine doesn't just smooth out those grooves. It helps your brain build entirely new roads, new brain pathways. This process is called neuroplasticity. And here's what shocked Heather. It worked fast. Within hours of her first dose, something shifted. It's like someone turned down the volume on the noise in my head, she said. But there's something even more critical happening during perimenopause. When estrogen drops, it causes much more than hot flashes and night sweats. It disrupts your glutamate system, the exact system esketamine targets. It could be one of the reasons why medications that used to work suddenly stop working in your 40s and 50s. Now, before you rush to ask your doctor about esketamine, there are 5 things you absolutely must know. First, esketamine isn't something you take home. It's only available through certified treatment centers. You use the nasal spray under medical supervision. Then you're monitored for 2 hours. Second, it can cause side effects, dissociation, feeling disconnected from yourself. Some describe it as an out-of-body experience. These effects are temporary but require medical supervision. Third, you can't drive until the next day after a restful sleep. Fourth, the treatment schedule is specific. Twice a week for the first month, then weekly for another month, then every 2 weeks or weekly for maintenance. And fifth, this is crucial. Esketamine works best when combined with other treatments. Heather didn't just get esketamine, she continued on her antidepressants. We optimized her sleep, we addressed her gut health, we balanced her blood sugar, we continued therapy. 6 weeks into treatment, Heather was sleeping through the night. Her panic attacks stopped. Her racing thoughts slowed. She started exercising again, meeting friends, laughing. I feel like myself again, she told me. For the first time in years, I have hope. You should, however, avoid Spravato if you have an aneurysm, arteriovenous malformation, a history of brain bleed, or an allergy to ketamine. One of the ways to ensure you attain optimal mental wellness during treatment is proper supplementation. So check out this video where I discuss the top 5 supplements I recommend for women over 40.